resources are available for CAR T-cell therapy care partners?
So I work with a variety of local and national organizations that do provide supports for CAR T partners. Some of that, some of like the bigger like national organizations would be like the American Cancer Society or the Leukemia and Lymphoma Society. They can link care partners with support groups for people who are doing caregiving for patients. Sometimes you do have to do a little bit of research. And I think now, especially kind of post-pandemic, still there's a lot of things that are being done online or through Zoom. But I do notice, especially locally here in Chicago, things are kind of getting back to where there is some in-person meetings. So support groups, I think, from organizations. I think also not only to, these are things that support the patient and the care provider both. This is something where as a social worker, I can help. There are many different kinds of grant programs, like in-kind actual like money and funds that are available for CAR T recipients and the care partners that can help them with cover the cost of transportation for all of their follow-up visits, or if they are needing to live like locally, in lodging or hotels following their CAR T hospitalization. There's a lot of organizations that can be tapped into that way to get financial assistance or financial help. And I think lastly, also the CAR T companies themselves, when we started doing this, I can't even remember here at the University of Chicago 4 or 5 years ago, maybe there were just like 3 or 2 CAR T companies that were offering CAR T. And now there's over a dozen, and we do so many now, and they're all different. And as much as I can, I try. But there are CAR T companies that actually also offer patients and care partners that kind of in-kind kind of support, like assistance, like financial assistance with food, with lodging, with travel. So those are all things, again, that helps the patient, but that also very much is helping the care provider as well, because they also need to make sure that their expenses are taken care of. So I always, whenever I'm doing the initial meeting with the patient and the care provider, I always say, check back, and it's with their CAR T nurse coordinator. Check back with your CAR T nurse coordinator. See if the CAR T that you are doing, see if that company offers any kind of actual assistance with transportation or with, your lodging or whatever. And there are patients who are flying from, other parts of the country who come here where they don't realize that their CAR T program actually can cover the cost of their flights when they're going back and forth.